So what are these scars? Scars are injury to the skin which extends from the superficial to the deeper layer of the skin. If you have very deep scars that happen after a surgery, sometimes even acne can produce deep scars. They cannot be permanently, completely removed without any residual of the scar. So let's focus on the laser treatment for acne scars. So then what is laser? So what we do is, if there is a big scar, if we remove the scar, we'll produce another scar. So in order to reduce the visibility of that scar, reduce the depth, which means reducing, when the scar visibility has to be reduced, the depth is reduced. So this is done by laser. So laser is an energy where controlled damage is created on the skin. Similarly, such controlled damage can also be done by microneedling or a derma roller. So they all make controlled depth damage on the skin, and as these damages tend to heal, they actually remodulate the scar. So this is the basic principle. Let's say you have an injury. So when you have an injury, you go to a doctor and the doctor actually sutures the wound. After 10-15 days, either the suture is removed or it's absorbed, but the skin unites. And this is because of the body's own capacity to heal. And this is done by platelets, the growth factors that are stored in the platelet, and that is why you hear about platelet-rich plasma being used in every form of treatment, whether it is hair restoration or it's skin rejuvenation or a scar correction. The PRP is used in the remodulating phase so that these growth factors from the platelets help the scar to heal, the controlled damage that is provided to heal in a better way, so that the visibility of the scar is reduced. So as far as acne scars are concerned, if we just use only peels will only reduce the depth of the scar, and if you reaccumulate dead cells, and then the scar will become back to as it was before. So best form of treatment for the acne scar. And to prevent recurrence of this scar, we inject fat grafting or nano fat, prepare nano fat or stromal vascular factors, and fill each and every one of these scars. So by doing this in one session, a combination of laser, microneedling. So why I prefer microneedling in some instances, because laser works wonders in type 1 to 3 skin, whereas our skin is more of pigmented skin. So extensive use of laser can also stimulate pigmentation, so the scars can improve, but then there will be some pigmentary damage. Instead, what we do at Tamira is specifically sometimes, if the acne scars is extensive, we under short intravenous sedation, we take the patient to the theater, and then we release the entire scar through specific cannulas which are meant to release scars. The tip of the cannula is like a tiger tooth, and then they release all the scars underneath. We handle the pigmentary problem, the irregular skin surface because of the scar, as well as remodulating the scar. So we basically release all the scars, we do a bit of fat grafting, we inject stromal vascular factor into all of these depressed scars, and if needed, we also do microneedling with PRP to make sure that the rejuvenation or the healing is better.